150,000 people are diagnosed with this every year. The president received the diagnosis after he was examined for swelling in his legs. With us now, CNN medical analyst Dr. Jonathan Reiner. He's a professor of medicine and surgery at George Washington University. Doctor, always great to see you. So what is chronic venous insufficiency?
So good morning, John. Chronic venous insufficiency is essentially a problem that arises when the veins that bring blood back from the legs no longer work efficiently. And when blood pools in the legs because it's not traveling back to the heart in sort of a quick enough fashion, blood pools in those veins. And over a period of time, and with the aid of gravity, fluid seeps out of the blood and the veins into the surrounding tissues, and that causes swelling, or what we call edema. There are a lot of things that can cause that. Some of them are not so good, which is why the White House did this testing. But what's interesting to me about this diagnosis is that the president didn't have it 3 months ago when he had his annual physical exam with Dr. Sean Barbabella at the White House, where they documented that he had no edema. So, while they're calling this, chronic venous insufficiency, which it sounds like it is, it's really more of an acute presentation of that, which is why the White House did, a number of tests to make sure that this wasn't something more severe.
When you have, as you say, an acute presentation of this, something that wasn't detected just a few months ago but is now, what could be the cause of that? And as someone who knows a little bit about hearts, Dr. Reiner, when and how can something like this, which is fairly common, when can this be a concern?
Right, because I focus on the heart when I see a patient who has a relatively new onset of edema in their legs. I first focus on, is this a cardiac problem? And the White House announced that the president did undergo a cardiac examination with an echocardiogram, which showed that there was no acute cardiac function. I'll note that Dr. Barbabella said that the president had a prior echo, earlier this year, but it sounds like they rechecked that to make sure there was no problem with cardiac function. The next thing you want to look at is make sure that the veins are not obstructed. And the president underwent an ultrasound test of his legs to rule out something like a clot or deep venous thrombosis. But apparently that is not the case. And then finally, importantly, there are metabolic problems such as chronic kidney disease that can result in severe edema, or liver problems that can result in sort of total body edema. And apparently the president has no finding of that. So the diagnosis of exclusion is chronic venous insufficiency, which then becomes more of an annoyance than a critical medical issue.
And the other thing that we heard from the White House was that the bruises on his hand and the discoloration, they say, may be caused from excessive hand shaking and the use of aspirin. What do you make of that diagnosis?
Every one of my patients takes aspirin, and I'm a little bit more skeptical about the large bruising on his hand because he shakes a lot of hands, unless he's having some sort of vigorous handshaking. That's a little bit more interesting to me. I see those bruises in people that take more powerful blood thinners than aspirin. Aspirin is a blood thinner, which is why we use it in cardiac patients. But I typically see bruising when people are on stronger blood thinners. So I'm a little bit skeptical of that explanation from the White House.
Listen, Dr. Jonathan Reiner, as I said, a guy who knows a little bit about hearts and some of the things we're talking about. Great to see you this morning. Appreciate your time as always. Sarah?
All right. The drama between President Trump and his former advisor, Elon Musk.